Hello,
Hello. How are you doing?
Maria. I'm good. Are you able to hear me?
Yes, I am.
Awesome. Had to do a different setup today, audio setup, so I wanted to make sure you could hear me. Maria, you prefer to be called Isabel, correct?
Yes. Yes, I do. Are we good to start?
We may need to wait another minute or so.
Okay. Hmm. Can everybody hear us fine?
Yep.
Michelle, what do you think? We're good.
We can go ahead and take a attendance and see where we're at.
Okay, let me start off with that. Good afternoon and welcome to the Subcommittee for Technical Assistance for the Governor's Interagency Advisory Council on Homelessness to Housing. This meeting has been publicly noticed in compliance with Nevada's open meeting law. Chair Michelle Holler, will you call meeting to order?
Good afternoon, everybody. It is 1:02 p.m. on June 18th, 2024, and I'd like to call the Nevada Interagency Council on Homelessness Subcommittee for Technical Assistance to order. Isabel, would you please call roll?
Yes, thank you. Chair Michelle Fuller-Holler,
Present.
Karen Van Hest,
Present.
Nolga Valadez, Dr. Pamela Juniel, Chris Murphy will not be attending today. Brooke Page,
Present.
Austin Pollard will not be attending as well. Christy Costa, Lorena Limas will not be attending. Kimberly Martin, Adrienne Babbitt,
Present.
Julie King,
Present.
I don't believe we have quorum yet.
Oh, I was on mute. Sorry about that. No, we do not.
No.
Let's wait for just a couple more minutes and see if we get another attendee that has not already let us know that they would not be attending. See if they join us in hopes that we do make quorum. Uh, we could have discussion on items, just not take action on items. Is that correct, Ryan?
Hi, good afternoon. It's Sia Delacus. I'm sitting in for Ryan today. And yes, you are correct. You can have discussions, but no action can be taken.
Okay. Is that also true on the items that say possible action?
Yeah, so I'm looking at the agenda right now, and that would be number 3. The approval of the meeting minutes cannot be done because that's considered an action. As well as, what were you thinking?
I was thinking like action item or item number 4 is actually more of a discussion content, but it does have action next to it.
Right. I mean, as long as there's no vote taken for any purpose, you can have a discussion about the proposed, it looks like it's proposed plans of action for strategic issues. You can have discussions, but no formal votes can be taken.
Okay, thank you.
Of course.
So with that, so that we can go ahead and have meaningful discussion, I would propose that we go ahead and move on with the agenda and skip to agenda item number 4 or we'll start with agenda item 2 with public comment, and then move to agenda item 4 if we don't have enough for quorum to start our discussion. Can I get just consensus? I can do a consensus. Is that correct?
What do you mean by consensus?
Just a nod or thumbs up from folks?
Well, yeah, I mean, there's nothing really pending. I think you just want consensus that that's how you wish to proceed for today's meeting. Is that right?
Correct.
Yeah, that's fine. You're gonna have to start with item number 2, and then you can move to item number 4.
Correct. Thank you. Okay, folks feel comfortable with that? All
Yeah,
right,
that sounds good.
Isabel.
Sorry, I meant to give it a thumbs up.
Okay, so we will go ahead and move to agenda item 2, which is public comment. No action may be taken upon a matter raised until the matter has been specifically added to the agenda. Comments are limited to 3 minutes. If you are making public comment via phone, please call 1-775-321-6111. The ID number is 758-695-708#. We are now open for public comment. Please unmute yourself and state your name for the council. Do we have any public comment at this time? There will be another comment period at the end of the meeting. If you're on the phone, I believe it's *6 to unmute yourself. Seeing none, hearing none, I'll close this item. Maria, have we had any members join us since we last checked in?
No, I don't believe so. It's still the same.
Okay, then we will go ahead and move on to agenda item number 4. No action can be taken on this agenda item since we do not have quorum. This item is for champions and TA subcommittee members to discuss the content for the plan of action for the strategic issues. As of my last check-in on our strategic plan and the action steps that we had received from the work groups, we are, and just to kind of bring folks up to speed on the kind of our proposed timeline, we had proposed to have all action steps turned into the homeless to housing team by the end of March, and then to move forward with cleaning all of that information up and having a solid plan to the ICHH, Interagency Council on Homelessness to Housing, by August, so that they could have that plan in front of them as they start working on bill drafts. At this point, we are behind schedule. A couple of the work teams did not turn in action plans or action steps to go with the section of their plan regarding their strategic issues. So we have kind of had to go back to the drawing board and kind of restructure and reassign some areas. So at this time, we need to have some discussion around the content and next steps, and kind of brainstorm some ways for us to address the action plan and how to move forward. So with that, I would like to um, pass the baton over to Brooke to lead us through some conversation. And I would invite all of our subcommittee members to come on camera and to really be active part of this conversation so that we can ensure that we can have some good strategic conversation about how to meet the charge that is before us. So with that, Brooke, I'll pass the baton to you.
Thank you, Michelle. Hi, everyone. So I think one, there is a really important need for us to acknowledge how much time and effort has gone into the action plan that has been developed thus far. I wanted to just first thank every champion who took the time to convene various different meetings to get us to where we're at. There are between our 7 different strategic issues, actually 8 different strategic issues, we have a significant amount of information that needs to be fleshed out and determine how do we proceed related to next steps regarding all of this information that's already been gathered. There's been working groups that have had diverse group of people that consistently met to compile their thoughts around these strategic issues, and we don't want to lose sight of that magnitude of work. And we have an important opportunity to synthesize this information to identify if there is an opportunity to move forward with policy recommendations from the information that we've already gathered. And so because that is there's a time sensitivity around that, and there's been work that has been done, I wanted to open up the opportunity for us to discuss the willingness of this body to maybe identify a small group of folks who are willing to comb through this material and identify where there could be some potential policy recommendations that could come from these action items that have already been put forward in the action plan, and to possibly bring those recommendations back to our July meeting so we could possibly decision those things. But I think there's a need to coalesce around what we have and not let that like perfection be the enemy of the good here, because we don't have all of our strategic issues at this time. But just want to open that up for the discussion and get folks' thoughts about that. Are there folks who would be interested in possibly joining a working meeting before our next July meeting? We can't have a walking quorum, so it would be a small representation of this group to just review the content and identify where we might think there's some substantive recommendations that could be made. Yes, Adrian.
I'm Adrian Babbitt, just raising my hand that I'd be willing to join that group.
Awesome. Thank you. And Michelle, you're interested?
Yeah, and I have a question. So, Brooke, with your proposed suggestion, would that just be members of the subcommittee, or would you consider including members of the general public as well?
I think a working group of any interested person who wants to be a part of this conversation should be allowed. I don't think it should, my opinion, I don't think it should be only members. If there's people who want to join, I know the working sessions that we did for the housing and the policy working groups were made up of the general population who were interested. So I think it's important to be as inclusive as we can, in my opinion.
So then, if I may, for because I think as a chair, I'm allowed to do this. If there's anybody from the public that is joining us from in this meeting that is interested in volunteering to be part of that working group or working session, I think that we can allow them to, raise their hand or volunteer to be a part of that group as well.
Shannon, I see your hand raised. Did you have any comment, Shannon, or did you just want to be a part of that sign up?
I just want to be a part of the sign up.
Awesome. Great. So right now I have Adrian, Michelle, Shannon. Any other folks or anybody have any comments about this approach or thoughts?
Brooke, this is Adrian. Are we going to be discussing any of the action in today's meeting? I had thought at the last meeting we were all tasked with reviewing what we had already put down and then looking to see if there were any overlap or duplication in the plan. But it sounds like maybe we're just going to be focusing on pulling out policy ideas of the current action. So I just want to make sure I'm clear on what we're doing with this action plan spreadsheet.
Yeah. So I think to the direction that was given at our last meeting, and I apologize, I wasn't at the last meeting, but the need to, deduplicate if folks have done that work. I think there was some tension around folks feeling a bit overwhelmed about the magnitude of work that needed to be done and not knowing how to necessarily move the work forward. So this proposal of having a small work group to synthesize what we have felt like a need as, just to kind of make a recommendation of the importance of moving the work forward. But if there is, during this call, if there's an opportunity for us to flesh through, removing duplication or providing comments for those folks that were able to go through it, I think we should, still have that conversation as well.
Okay, thank you.
All right, so we will start with our three folks. Please, we'll maybe follow up with you all after this call to schedule a time before our next meeting to get together and flesh through policy recommendations. I also think that there is a need for us to, we have some areas that we were not able to get goals and action items identified because of some of the champions weren't able to convene their working groups. And I think that is a topic we want to discuss with you all. What should we do with the areas that we currently don't have action plan information for? There were some ideas about possibly making an argument for getting some consulting support to get that component complete, or building out other ways to facilitate that, because we're asking people with full-time jobs to do a really important level of work, and it's a lot, right? And so wanted to get also open up for conversation, thoughts about how we get the remaining content complete for our action plan. And Adrian, I see your hand up.
Thank
And
you.
Shannon,
So,
yeah, go ahead.
So I just wanted to share that at the last meeting, I volunteered to be the champion for strategic issue number 2 and held a convening this morning to start like brainstorming some action items potentially for prevention. So there is a lot more work that needs to be done on that. And so just wanted to be clear moving forward if I should continue to try to develop that, or if that plan is going to shift.
Well, that's awesome. Thank you for taking the initiative, convening a group, and getting information. I think ideally that's the process that we've taken as a work group, is sort of identifying a champion within our existing members, and then having these community conversations. If that's capacity that you feel comfortable moving forward with, I think we should continue, the work there and continue for the prevention and strategic issue. I think education and workforce was another area that needed that same level of championship and support. So I'm not sure if that category was also identified in the last meeting, but that's just my recommendation. I'll open it up.
This is Michelle. I think I would concur, regardless of how we move forward for this, to give recommendation to the ICHH for this year's upcoming legislative session. We still need to really flesh out the action plan itself. And so we need to get input from the community, the state as a whole. So I think Adrian, you're moving forward as we have with the other strategic issues to do that. So I commend you for doing that, and I think that's a good solid plan as far as moving forward. And I think we need to do that with I think it's education and workforce as well. I'm afraid at this point we might not have it all complete in the same vein we've been going by August. So, but I would encourage you to, if you have the bandwidth, to continue.
Okay, thank you for that. I did have a question about our existing action items, if there's space for that discussion.
Can you clarify, please?
Yeah, so when I was reviewing the spreadsheet, I have a question because we're talking about policies, and there are several policy ideas that are listed in various strategic issues. And so I'm wondering if any policy is meant to go in the policy issue. However, some of the policies that are suggested are not clearly defined within the goals in policy, but they are potentially in line in the description of the issue itself. So I was just trying to figure out, like, if all policy goes in policy, or if it's likely that we'll have several policy action across all of the strategic issues.
That is a great question, and that's a great thing, a great discussion item. And if we can put a pin in that for just a second, I would love to come back to that, because that's something that I was actually pondering myself as I was going through the action items that were in the strategic plan. So if we can just put a pin in that for just a minute, I would appreciate it. Shannon, you have your hand up.
Sorry, I just haven't put it down. I volunteered.
Okay. Your hand was up for a while, so I didn't want you to, your hand to get tired hanging up there in the air. Brooke, did you have anything else that you needed to discuss, or did you have more that you were going through?
Well, I think there's two things on the table, in my opinion. We've gotten a working group, a few folks who have raised their hand to flesh out these recommendations. And I think it aligns with Adrian's question about, categorically, are these things exclusive to just the category in which they're being raised? And I I just don't think this is linear. I feel like there's so many things that are contingent upon one in order to, align with another. And that's the importance, I think, of having this working group to flesh out the recommendations, because there's absolutely going to be overlap. And the policy opportunity, I think, is because there could be administrative policy change, there could be legislative policy change, and those are things that I think the essence of the policy working group, I think, was more like innovate, like just what are the innovation and the policy ideas that maybe we haven't thought of as a state that were kind of being bucketed in that group. But if there's policy ideas that come from prevention, we absolutely, they should also live in the policy bucket. So I think that there's just so much overlap. But it would be great if this working group can help us flesh out these overlap, the conversation, and really hone in on what are the 1, 2, or 3 things that we could do, low-hanging fruit or major changes that we think we want to champion, and let's sort of propose what that looks like in this, kind of pre-planning of a legislative session. So that's one area. The other area is there's still education and workforce. So great that we've got Adrienne championing prevention, but we've got education and workforce. Was there a person identified to champion that at the last meeting? Okay. So the question on the table, I think, is, are there ideas around how we get this work complete? That work group needs to get fleshed out, and ideas need to come from workforce and education. But I think, to Michelle's point, there's also this need to ensure that we get a broad representation of the content that we have. I know, like, the work groups that I held were, we probably had a consistent 5, 6 people that continually came to those meetings. They could be more diverse. We need diverse perspectives from rural, urban, frontier communities throughout the state. And we want to make sure that that due diligence happens, so it doesn't feel like it's insular to just the work group is coming up with these ideas. And so is there a need to get someone to help us really finalize these ideas, these recommendations, and finalize this plan, with maybe some additional outreach and engagement with the community to get diverse perspectives on these ideas? So wanted to open that up to see if there's thoughts about how do we land this ship and get, this to the finish line.
Yeah, that was a question, so please unmute yourself. Give us your ideas and thoughts.
This is Adrienne. I just want to clarify to make sure I understand the question I'm answering. We want to make sure that the action plan that is being submitted in final draft form, it has the buy-in and appropriate input / representation of the entire state. Is that what your
Yeah.
question is? To make sure that we have everybody who wants to have input has input?
Yeah, so that need to kind of take this action ideas on the road and just get feedback, perspective.
Yeah.
And also help us flesh out this action plan itself. There feels like there's a lot of work that maybe this committee doesn't have bandwidth and capacity to do all the things. It is a lot of work.
Yeah.
So just wanted to see if there's other ideas of how if we subcontract this out to a consulting firm to help us finalize. Do we task this with one of our state agencies to help us figure out how to finalize? Just wanted to get your working group ideas about how we get this to the finish line.
And the finish line date is August?
So I thought I think it's arbitrary. I think it's what we think is realistic.
Okay.
And what we think, is the next. It's important, I think, to have a date that we're working towards so things don't lag. And so we've put these checkpoints. March 31st was the first checkpoint, like just to get us and make sure that we're staying true to some movement and momentum.
And this is Sia DeLucas from the AG's office again. I just wanted to put a gentle reminder out there that while you can discuss potential ideas, there can't actually be any decision towards what to do with any of those ideas, since we're not, that would be a formal vote required, and we're not there today.
Great. Thank you so much.
Of course.
So I think maybe we just put that out there for folks to ponder, and we can decision. But if anybody has ideas about this, it'd be great to maybe have a slate of ideas that we can decision during a meeting that we ideally have a quorum.
So while you're thinking, to Adrian's point earlier, what we'd asked you all at the last meeting, and actually I think Brooke had suggested the meeting before, which I had not been at, to identify, kind of go through the action items and identify if there was overlap and if there were areas where action items needed to be moved. If there's anything that y'all have in action items where you think need to be moved, if you want to share that with the rest of the group, we can take a look at those things now, and you can share those, and we can actually. I have the action plan up in front of me. I can share my screen if y'all would like, and we can make note of where you think those might need to be moved. You want me to share my screen? Or do you all have the action plan in front of you and that's just as easy?
I think you should share your screen, Michelle.
Will do. Now, y'all bear with me. I've already started like color coding some things, so I don't know if you can read through my color coding.
Nope. This is not ADA accessible. I'm just kidding.
Yeah.
I can change all of that back to black. How's that?
So Adrian, it sounded like you had some changes that you would like to maybe discuss from what you went through.
Yeah, so many of them were questions about should this be moved to policy, right? But there was a few that could be potentially moved to data, or strategic issue 6, I think. So for goal 1, strategic issue 1, establish data tracking systems. Should that potentially be moved to, I feel like I have too many screens open. Sorry, hold on. To the data issue.
So this one right here, establish consistent tracking data systems.
Yes.
So you're suggesting that one be moved down to strategic issue 6?
If that makes sense to others, that was my thought. Yes. I mean, many of these things are all intertwined, right? So
This is Sia DeLucas again. Sorry. I would propose that we may make notes of whatever the suggested changes are, but nothing can actually be changed unless we have a quorum. here to do that. So it might be, maybe we can start a new document or something
It is a new document.
well, I'm just saying we can't formally make any changes to anything without the quorum, so.
Correct. I just started a new document.
Okay.
I just did a save and started a spreadsheet one as a new document, and I'm making the changes under comments. So I'm with you.
Awesome, thank you.
So that we know what the proposed changes are, and it's not in the original document.
Also, that's duplicated, Michelle. The bullet point that you've highlighted is also the same as the second bullet point there, I believe.
I'm going to put this over in the comments section. In the
Where you were, Michelle, go back up. The second bullet point in AB and that, yeah, is the same.
Oh, yep.
So it just like needs a strike through or something.
What were your color coding, Michelle? I see you're using like blue and yellow.
Yeah. The blue was for um, the light blue was for policy, and the yellow was for data.
Okay.
I don't know how to make that go on another line.
I think it's alternate enter.
Alternate enter. Haha. Thank you.
Mm-hmm.
And you're right. That is exactly the same, isn't it?
The policy items that I had highlighted potentially on strategic issue 1, goal 1, were regulating what the insurance companies could can and cannot cover. And then I feel like potentially it says investigate limiting the number of properties out-of-state investors can purchase. That feels like that could lead to a policy idea. But I don't know that I would move it to policy until the investigation on if it could be done occurred.
But I think the essence of it is a policy change, so it makes sense to put it in policy. If it's
Which one was that?
the issue around the properties out-of-state investors can purchase.
The last bullet point there.
Oh.
But I would also just say, again, like even though that's the essence of policy, like you were saying, I don't feel like that policy clearly fits within the sub goals of the policy issue.
Right, because it's focused on supporting policies that address equitable access to housing. Oh, that's 7. Yeah. Her justice involvement. Yeah, some of the goals are very specific.
Right. So that's why I didn't know if we could, like, does the strategic plan expand to, I mean, because the description of like what the policy issue is managing for, I think fits with the intention of that policy idea, but it's not supported necessarily in the specific goals that are listed.
Mm-hmm. Then maybe there's a need for an alternative goal or something.
Yeah. And if not, then I think we just accept that we have policy ideas sprinkled throughout the plan, not necessarily only in strategic issue 7.
Mm-hmm. Because like the first bullet point in goal 1, technically it could be in the prevention. Well, no, I guess it's not prevent. Never mind. It's in preservation.
So those are my only notes on that particular goal for housing.
Other thoughts? Want to move to goal 2? Anybody have anything on goal 2? Under strategic issue 1?
Now, bullet point 3 and strategic goal 2, to me, is a policy recommendation. But not sure which goal it would align to under policies, but this would be an area where we would want to maybe consider in the work group what a policy recommendation would be for this one.
I had that note also.
I'll be honest, I'm just popping them down under policy. I didn't put them in any specific thing in policy.
Okay, yeah, I think that's fair because I think
Sorry.
some of these are outside of the
I guess I
specific
put them
goals.
in the top one, but I wasn't like, I wasn't paying attention to where I was putting it.
Mhm. Yeah.
And so it's good about like a policy like the one that we just moved. Like there is a housing policy forum that's coming up. And if that's something that, is in the Interagency Council on Homelessness and Housing Work Group wanted to sort of provide an opportunity for that to be pitched to other bodies, that's why the timing of this is so critical, because a lot of those policy conversations are going to be happening fairly soon. And so without, if we wait on something that could be like a pitch or an idea, it's important that we flesh out what these are, like ideally in the next 2 weeks.
I agree. I think the policy forums are towards the end of July. Is that right?
Mm-hmm. Yeah, but they're going to be doing a call for
Yeah.
action. So call for policy recommendations. And I think the Interagency Council on Homelessness to Housing has a policy recommendation, and a lot of those bill drafts have to be in by a deadline.
Yeah. Okay, so for goal 2 in housing, I had 6 question marks on policies for the bullet points. There felt like a lot. Some of them were a little vague, I thought, that maybe, would need to be fleshed out a little bit more, but like it just says prioritize policies that are tenant right focused and incentivize communities that have low barrier access to housing. So with Michelle, did you have that one as a policy? Okay.
Yes, I did.
And then other ones I had flagged were increase tenant protections to address rent control to prevent evictions, increase accountability of property managers to reduce barriers to entry. Those I had question marks on if those were policy ideas or not, or how we would increase those things.
I had both of those marked as well.
Did you have prioritize the development of supportive housing that targets access to housing for specific populations? And develop policies that require housing interventions that are evidence-based solutions and research-based.
I didn't have that one. I did have that one as a question mark.
Mhm.
I did have develop policies that require, I did have the develop policies that require housing interventions that are evidence-based. Yes, I did have that one.
Okay.
And then I had, I had another one too. Recommend policy changes to source of income discrimination and equitable access to housing.
I wasn't sure if that one would go in policy because it's recommending changes, not developing. And so that's where I wasn't sure where the distinction would be on like advocating versus implementing.
Well, as the champion for this work group, I think the essence these are pain points that people raised that need to be flushed out. And I think the intent of the action plan was to take these priorities and then identify what are the steps to flesh this out. So like, is action 1 to do the research on what the existing policy is and identify what recommendations are there to make changes there. So I think some of the fleshing out is what I think the intent of the action plan process was, to kind of take this to the next level. These were the larger ideas. And then how do we kind of drill that down into some actionable next steps?
So in your opinion, do you feel like we would leave it here or move it to policy?
I think we should leave it here. And then if a policy comes out of those action steps, then the policy goes to the policy, but there may not be a policy recommendation or change, right? There might just be some retooling or some education that's needed, or,
I also had the tracking mechanism for move to data potentially, or discussed to move to data. And the very second to last one as a potential wraparound services or health coordination.
Did you move over recommend policy change to source of income discrimination to
Did I?
policy?
No, I did not.
Okay.
It's right here. Okay, so the tracking mechanism, you suggest moving to data? Oops, and what was the other one? The bottom one, increased supportive
was-
services?
Yeah, I had a note for myself, wraparound services or health coordination.
Okay. Thoughts? Thoughts from the team on where that should go?
I mean, it sounds like wraparound services makes sense.
Okay. The other thing I had marked was the public awareness campaign. There is public awareness campaign is identified in long-term planning, I think.
Long-term planning and housing feels like an oxymoron to me. I'm sorry. It feels very much like it should be a merged group, but that's just my opinion.
So potentially developing the public awareness campaign and then long-term planning facilitates ongoing, continuing
I don't know.
campaign.
I don't know. I kind of agree with Brooke. I kind of feel like housing and long-term planning are synonymous to me. um, I and I felt that. I mean, I was the champion for the long-term planning, and I felt like a lot of the things that we were talking about really should have been in the housing section. So that might be a conversation at some point we need to have about, do those things get kind of collapsed, and that's iterate the next iteration of the strategic plan, right? That those things kind of get merged or redesigned a bit. Okay, other thoughts around this goal 2 from anybody? Is everybody multitasking today or what? We can't hear you, Karen.
I said, yes, it's the end of the fiscal year.
As a matter of fact.
It's crunch time.
Well, nothing like being honest.
Sorry.
All right. Anything in goal 3 that needs to be moved?
Hey, Michelle, I had a question about the develop standardized data-driven process one, on whether that should go in data. I don't feel like it fits into the description of care mapping, but if the definition was expanded, then that might go there. I don't know. And these are notes that I made for myself like a few weeks ago, so don't ask me to clarify that.
Are you talking under goal 3? The develop the standardized data? Which one are you talking about?
Develop standardized data-driven process and robust community engagement practices to capture data to inform a statewide annual housing needs assessment to study and track existing inventory, development pipeline, housing production, preservation, and loss over time for affordable and supportive housing. Data should include race-specific metrics to ensure that plans and outcomes resulting from needs assessments are equitable.
What do other people think?
What's the question?
Whether we think that might want to be moved to data.
Hmm.
I mean, as data currently stands, maybe not, but maybe the data section needs to be expanded a bit.
It just because this goal is specific to supportive housing, it feels like this is a major action step needed to develop supportive housing. I feel like if we move it, I mean, maybe there's a dotted line to data because there's a intersection there, but moving it, I think, takes away from a major component that's required in order to ensure that, you know, things are data driven, and the pipeline for supportive housing is data driven, and it's not just done, you know, we're not developing stuff that's not needed in our housing stock.
Mm-hmm. So would that be like develop the data and then use the database, be like different action steps there?
Yeah, I mean, there's probably a lot of steps within this,
Yeah,
but
I
this
mean,
was just
yeah,
kind of like a major piece
yeah.
of it, because without the needs assessment study to track what we have, it's hard to create a plan for what we need. And so this is the intent of this, is to really have a robust plan.
Yeah, I mean,
So
I had a
definitely.
question mark next to it, so I just wanted to have a conversation.
Mm-hmm. That's a good one. I think it needs multiple steps.
I didn't
So
have other notes on this one.
So it sounds like that once that gets fleshed out, and that for the tracking of that, we need it in data. So we probably need some language in the data section regarding whatever ends up in the action plan, that speaks to that for tracking those activities.
Yeah, is there a goal in data that calls for that?
Not currently, but that sounds like we need to have one.
Mm-hmm.
So, okay. Next section, 4. Anything from anybody?
I mean, I think bullet point 1 could be a policy idea.
Okay.
Did bullet point 2 come up in data?
Nope. The data section really was about uh, the data section really only has 2 goals in it. It's the um, mapping and integrating the data across all systems of care, and then working with UNLV for the data mapping project. That's all that's in it.
Well, this sounds like a mapping exercise. If we're asking for transparency around the system, the housing finance system,
Mm-hmm.
and then tracking their housing inventory on a dashboard.
So we want that one as data? Is that what you're thinking?
I mean, what's maybe a dotted line? So not move it, but similar to what we did in the other goal, like it just show that there's a connection to the data conversation, maybe.
Okay. Anything else in this section? What about goal 5?
I had a question about the statewide tracking system again. What they are used for and eligibility criteria to access funding, either in data or long-term planning, I put.
Develop a statewide tracking for all funding sources?
And then I had a note about developing systems for Medicaid to interface with COCs, coordination with medical.
Oh, okay.
That actually also came up in prevention and intervention about leveraging something about leveraging existing resources to prevent or divert homelessness, and being able to know who already is covered under Medicaid. So I don't know if that's, I have to give that some more thought.
Okay. Other thoughts for goal 5?
Yeah, I'm looking at the engage with outreach and engagement at the university to connect students. It's the second to last bullet. Does that make sense to be in the education and workforce development one?
Yep. Makes sense.
Oops. Okay. Anything else for goal 5? Goal 6.
Michelle, do you mind changing that turquoise or
Sure
yeah,
thing.
black? Thank you.
I had the develop a roommate housing opportunity database system to connect people to potential roommate opportunities under maybe prevention or intervention. Although this goal 6 does specifically talk about shared housing and roommates, so.
Yeah, it could be prevention, or it can also be the intervention for folks that are currently unhoused.
Let's just put it in data.
Everything goes to data.
That's actually what I was thinking. I'm like, I see database system and immediately go data.
Data.
Would they identify ways to improve housing choice vouchers and all that stuff? Would that be it's not a state policy, but it is policy regarding the housing authority policies, isn't it?
I think that would be more like landlord engagement to improve utilization if that's the identified challenge.
Yeah, this was, I think, your idea, Adrian, like the need to increase that utilization because it's not really, that's one of the pain points, I think, with the Housing Choice Voucher Program is low utilization. So is this like a strategy to work with the housing authorities to figure out what's the ideal utilization rates? And then what's keeping that?
Right. Unless we're looking at like source of income protection as policy.
Mm-hmm. Because
I mean, I
that's,
think it
yeah,
could be multiple.
right. Yep. You may need a stronger, but I don't know. People find other ways to discriminate, I guess. If source of income ends up, it does feel like one is contingent upon the other. Stronger policies that require landlords to not discriminate based on source of income, but again, I don't know. The enforcement of these things is really where the challenge is too.
Okay. Prevention, intervention, Adrian, you're working on that. Wraparound services. Is there anything in wraparound services that you that anybody identified needed to be moved?
There's one towards the bottom of goal 1 that I thought maybe data, it's the data sharing and outcome tracking. But I don't know, I'm questioning everything today. Tired.
Is that this established mechanisms for data sharing and outcome tracking between continuum of care providers and state agencies?
Yes.
Why isn't it letting me? Okay. Anything else in this goal? Okay, goal 2.
This entire goal feels like it should be in the prevention and intervention section. I don't know if we would want to consider moving an entire goal, but my thoughts.
Hmm. Thoughts from anybody?
I'm just processing that for a minute while I read through some of these. Sorry to. Who was the champion for this wraparound service issue?
Let's see. Good question. Let me look.
Because I think like goal 2 and prevention and intervention talks about like leveraging benefits, targeted outreach, collaborating with community partners, like, so I agree that some of this is overlapped. But I wonder if there's a distinction between like, again, advocating for other people to do that and then actually implementing things on the ground. If there was like a line that was drawn in the school, like providing materials to prevent potential funders regarding best practices versus support housing programs and agencies to provide housing problem solving, centering on homeless prevention.
I don't think it's all inclusive to prevention though. But
So maybe we just would need to drill down on like what wraparound services.
But this, I think this is a larger goal than just wraparound services. It feels something that should be broader to the ecosystem of preventing and ending homelessness broad, like general. Because all of these things I think are maybe where we're lacking in this work is an informed funding source base from philanthropy, corporate sponsorships, and private public partnerships, and all of these strategies that are identified here. You know, if that's sort of a more strategic alignment of the ask and how funders can interface with the work, not just wraparound services, but all the things. Like I think all of these things could apply, but I don't know if it should just live under one wraparound services, if that makes sense.
So where do you think it should live?
I don't know. This is like it feels like it should be all like a, I don't know, maybe it's, is there a communication, outreach, and engagement category? Just feels like this is broader than just one topic.
Is that maybe like long-term planning?
I think that's kind of what the, like, I think there was an intention in long-term planning, like with the, community concerns to dispel. So that's where this is where the public awareness thing came in.
Mm-hmm. Yeah, maybe there's a goal here because it feels like there needs to be some consistent messaging around how the issue is being elevated and talked about, and the funders understanding the state of the issue from all, different, depending upon if you're northern, southern, rural, balanced state perspective, there needs to be like an understanding of this issue.
Yeah, and there's like centering voices and using framework centered on justice. And so maybe we need to, as we're redefining and restructuring, maybe some of the things in long-term planning, and maybe we change the term long-term planning to something different, and we use this section under long-term planning for more of that communication, public awareness, framing the issue, and move the housing related stuff into housing. Maybe
Housing,
that's
yeah.
kind of what we think of, how we think about things as we restructure.
Mm-hmm. Like it's strategic planning here, not necessarily long-term planning.
Yeah. Okay. So I think what I'm hearing is that, let me get back there. Um, where was it?
Wraparound services.
Wraparound services. Here we go. Um, or a yet to be defined section. How's that sound?
Mm-hmm.
Oops. That's not what I wanted. That's the page that wouldn't open. Nolga, Karen, and Pamela are the champion and chairs for wraparound. Okay. Goal 3. Rid of this.
What's your color coding there? What were your thoughts on that, Michelle?
The purple was coordinated primary and medical and behavioral health. the teal were policies, and I don't remember what the other colors that were in there were. Yellow is coordination of data and resources. Pink is long-term planning.
So I don't know about y'all, but I feel like I'm getting fatigued. Do you think we
I-
should put a pin
I
in it and
agree.
maybe
Yeah.
like we did a lot of like brainstorming on this. Maybe we put a pin in it and pick this up where we left off for the working group to discuss more, but then also to decision some of these things at our next meeting.
The other thing is, Adrian, if you want to send me your thoughts, I can make notes on the this worksheet, and then I can provide the worksheet at our next meeting for the movement, so folks can actually see it. And if
Yeah,
anybody else has any thoughts as well, you can send them to me, and we can actually, get them into a document and actually see them and use them as, as we are doing some of this work.
Mm-hmm. Real time, like strikeouts,
Yep.
red marks. Maria, did we ever get a quorum while we were talking?
No, we still
Okay.
didn't get meet quorum.
Okay. So any other thoughts or conversation around the content for the action plan for the strategic issues? Again, remember, we can't vote on anything, but we can have conversation.
I'll just follow up with the folks who raised their hand to see and do a doodle poll to see when you all can meet. So look out for a meeting notice.
Brooke, do you feel like we should be strategic in inviting others to that group that may not regularly attend this meeting for who we think we might benefit the conversation?
Yeah. Yeah, you can maybe share the invitation with other people. That'd be great.
I know we don't normally take breaks in this meeting, but I have to step away for a minute. So I apologize.
Okay. So with that, our next agenda item, again, we cannot, excuse me, we cannot take any action, but we can have discussion around the upcoming conference and request to provide an update of the strategic action plan as a session. So we were requested by the planning committee for the third annual statewide conference on ending homelessness if we would again do a session from this group on the update on where we are with our strategic action plan to the conference. So I'll put that out for conversation to this group since we can't make a decision today. But is there any thoughts or concerns that anybody has around representation from this group doing a presentation at the statewide conference. That conference is in October. It is October 7th and 8th, I believe. Dr. Bedford Grigsby, you're on the line. Is there anything that you would like to add to that request?
Just I'm looking at the wrong camera, so just the dates. The date is October 6th and 7th.
6th and 7th, got it wrong. Sorry.
No, 7th and 8th. I'm sorry. 6th is a Sunday. It's in my head because I got hotels for 6th. Okay. So 7th and 8th, which is Monday and Tuesday. And so I know you guys are not making a decision today, but as you talk through this and figure out, is this something you want to do, you kind of get the opportunity to choose which day you want. And then it will be in front of the full conference attendees, not a breakout session, just like it was last year. So that's pretty much all I want to share. And people requesting an update. That'd be a great addition, I think. Thank you for bringing it up, Michelle.
Thank you for the request. Okay, thoughts from the subcommittee?
I was just thinking, because this is, we sort of launched this process at last year's conference. Like, I think it is, would be really a great opportunity, hopefully by October, that we've got a really solid plan that we could present during that time. It would be great because, you know, to see what we said we were going to do, we did, and talk about our process and the way in which we leveraged a lot of the people that were in that at the conference to be a part of the work groups that met to develop these actionable next steps. I just think it would be an important follow-up to this conference to be able to communicate that. So maybe we use that conference as a goal, that we have our, you know, a final draft of some sort ready by that conference date.
I love that idea. Other thoughts, ideas? Anybody dying to present at the conference?
This is Adrienne. So I concur. I'm on the planning committee for the conference, and I think it was my suggestion that that follow-up occur. So yes, and happy to help present any materials if that's needed. Not by myself. However, in a team capacity.
Okay. Appreciate that, Adrienne. All right. Anybody have any angst about it? Nope. Okay, not hearing any. I'm gonna take that as consensus that folks are good. All right, with that, we're gonna since we can't do any votes, we're gonna close that agenda item. We're gonna move on to agenda item number 6. Do we have any suggestions for our next agenda that hopefully we will have quorum for, and that we can have voting items on our next meeting in July?
There's been a few members who I feel like have consistently not shown up to these calls. And I know that we've got folks that have been consistently attending and have applied. Whatever the process was that we had to do in order to remove a member from our body, can we initiate that at our next meeting for folks that may meet the criteria of not being present?
Isabel, can we do can you guys do a review of the attendance and just to verify who has and hasn't attended on a regular?
Yes, will do.
Thank you. And uh, we can do the calls to, or the outreach to ensure that letting them know that they have not been making their um, commitment to this group for attendance. I believe that Shelley has the language that we've used.
This is Karen. I thought that we just did that like last month or the month before too.
That's a great question, Karen. Did we do that for everybody, or did we only do that for for one or two particular people?
I believe it was one particular person.
Hmm.
That at that point we knew had been a consistent absentee.
That's correct.
Okay.
The other agenda item, I think it would be good if we could maybe get a update on the point in time counts, if those are public information. I saw a national news article about data related to our PIC counts, but I wasn't sure if that's something that our local jurisdictions have already released all of our 2024 PIT numbers.
I believe the rural Nevada COC is the last one to release theirs, and theirs will be released tomorrow or Thursday. So I think that that probably would be something that we could do. Is Brenda Barnes still with us? I
No,
think I
no,
think
she
she
left.
left.
She left earlier.
Yeah, but I think I'd seen a release report from the Southern Nevada COC in May. So yeah, I think that we should be able to do that.
Michelle, I think that that was a draft. I don't know if that was their final numbers or not. We'll have to get clarification.
Okay. Well, ours won't be final. I mean, Apt Associates hasn't done their validation yet. So just for edification for this group to know the process for point in time count information goes to HUD in their HGX, the HUD reporting system, and then once it is submitted to HUD, and there was a delay in the submission date this year because HUD changed their portal of submission, so there was some challenges in getting in their data system. But then HUD has a technical assistance firm that validates the data. And then once the data is validated, then it becomes final. So there's always a chance that during the validation process, the numbers may change. And so that's why there's hesitation in for some COCs to release their final point in time count numbers prior to the validation process. Because there's have in some cases when the information goes out, there has been some backlash if there is a data change after the validation process. So just letting y'all know some of the reticence that has come from COCs in releasing data as soon as the data is submitted to HUD or right after the point time count. But there's no hurt in asking the COCs. Anything else you would like on the next agenda?
Michelle, did you already capture the things that we had discussed earlier in this meeting?
No.
So we had talked about making a decision about how to flesh out the action plan, about like getting a consultant or some other body. I don't know if that was multiple choice or if that's a discussion and then a vote. And then discussion on the conversation, discussion that we had today around movement of potential plans of action.
And then we need to also put get permission from this group to participate. Do we need permission to get from this group to participate in the conference?
This is Sia DeLaca. Sorry, it does need to be put up for a vote, is what I understand from the current agenda item.
So we need to put that back on the agenda for next month.
Correct. Yes.
I think it might be good to add maybe who is also going to be presenting as part of that decision. So those folks can start pulling that presentation together if it gets voted in. I don't know if it's two different items, but.
Where was that conference going to be again?
It's in Las Vegas this year.
Ah,
No, it's in Reno, isn't it? In Northern Nevada?
I think the Coalition's conference is in Northern Nevada. The Homeless Alliance is in Las Vegas.
The Homeless Alliance Conference is in Las Vegas? I thought it was in Reno.
I think last year they were in Reno.
Oh, yeah. Okay. Thank you.
All the years kind of just blend together, really.
Yeah.
Conference season.
Anything else need to be on the agenda? Okay, Isabel, did you get all that?
Yes. Yes, I did.
Okay. All right, last call for agenda items. Okay, with that, I'm going to close that agenda item and we're going to move on to agenda item number 7, which is our last public comment for this meeting. No action may be taken upon a matter raised until the matter has been specifically added to the agenda. Comments are limited to 3 minutes. If you're making a public comment via phone, please call 1-775-321-6111. ID number is 758-695-708#. We're now open for public comment. Please unmute yourself and state your name for the council. If you're on the phone, I think you need to press #6. Any public comment? I think everybody has fallen asleep or has tuned us out. But seeing none and hearing none, I'm going to close this agenda item. And it is 2:41, and I'm going to adjourn this meeting. thank you, everybody, for sticking with us, for being with us today. And I will see you next month on July 16th, same bat time, same bat channel, for the Interagency Council on Technical Assistance, Technical Assistance Committee. And we hope we'll have quorum so that we can make some decisions. See y'all
Thank you.
later.
Bye.
Thank you. Bye.
Hi, everybody. Have a good afternoon.